the relevance of information technology in social work practice. In social work practice, I'll share with you my prepper, which I already did on PowerPoint. First, we'll be looking at the outline. We have here definition of global definition of social work, the global definition of social work, what information technology is, what it implies, importance of information technology in social work practice, ways information technology enhances social work career. And then we also have an explanation and a brief discussion on the National Association of Social Work Technology Standards in social work practice. I'll start with the global definition of an introduction. You see, globally, every society involves its structure and economy, and from time to time. And it's also important for us to know that people connect online via the internet through social media. It is also apt for every social worker practicing to seeking to begin in social work to understand how their roles is evolving from time to time. This paper will be focused on giving us a brief highlight on how social information technology guides the social worker in terms of practice, how this information technology is properly utilized in our course of our job, in the course of carrying out our duties. Let us briefly look at what the global definition of social work. The following definition was approved by the International Federation of Social Work General Meeting and the International Association of Social Work General Assembly in July 2014. The definition of social work here is it's a practice-based profession. Social work is a practice-based profession and an academic discipline that seeks to promote social change, social development, cohesion, empowerment, and liberation of the people. You see, the principles of social justice, human rights, collective responsibility, respect for diversity are central to the practice of social work. Social work is such a humanitarian profession that you need to that brings about change, that brings about the development of society, families, individuals, groups as a whole. The main mission of social work is to ensure that we bring about a transformation in society and improve, enhance the social functioning and well-being of members of the society. Let us now look briefly at information technology. What does information technology implies? Actually, this is a generic term that covers the acquisition, processing of storage and dissemination of information. It involves application of computers, electronic gadgets in the tasks of information handling, communication, and service delivery. Our information technology channels includes emails, SMS, video chats, Skype, online services, and other computer devices. So that is basically what you see as the importance of what information technology is. We'll also briefly look at the importance of information technology in social work practice. What does it imply? What do you mean? What do you understand by when we say importance of information technology in social work practice? Here we are trying to look at the relevance of information technology, how information technology affects social work practice. What benefits does it have in social work practice? How does it improve? How does it build or support our services? How does information technology guides, assist the profession, the social work? Yeah, we look at it. It's in social work. It enables the social worker to be able to render some services to the client, to a group of population, to people with from the geographical locations. Remote geographical locations are able to meet. The social worker is also able to. Students are being trained through the use of information technology. Social work students, they learn a lot from the information technology, use of information technology, in accomplishing various tasks and computer networks. Social workers also use various forms of technology to gather and manage informations of the clients, which is very essential. In our duties as social workers, we strive to see that we are able to manage our clients' information, the data we get in the course of our interaction, the data we gather from, through interactions with our patients, our clients, and neighbors, or those who service users. we're able to manage this information effectively. That's one of the key importance of information technology in social work practice. And importantly, it helps the social worker to be able to provide services to greater volumes of clients. Through the internet, we're able to reach a good number of clients over time. Unlike in the early days where we didn't have much internet facilities, information, electronic gadgets, but these days, as society is evolving, we find that with the use of information technology, a social worker is able to reach out to a greater volume of clients. Now let's look briefly at the software and applications used in social work practice. Just like I earlier said, there are other applications that social workers apply in the course of carrying out our services, in the course of carrying out social work interventions with clients of various groups, with varied populations. Most importantly, we need to understand the kind of clients you're working with. Possibly sometimes you meet clients who have some forms of disabilities, but we should ensure, social workers should also ensure that these various clients are able to make use of computer gadgets, electronic gadgets. So they should be also be aware of the uses of these various computer gadgets. We also have some of these software applications like the electronic data management, the electronic medical records, the electronic health records, the color notes, and the Google Sheets. These are very useful gadgets, useful software applications that the social work practice have been helpful to help us carry out our interventions. And then, most importantly, in storing of informations that we gather from the field, from our casework practice, from our interviews with our clients. Now, let's also look at the ways in which information technology influences social workers' career. It does a lot of, it has a lot of significant effects on a social worker's career. We look at from the first and foremost education. Social workers are being trained. These days, we throw it online. You can find so many programs, higher universities, colleges running master's programs, PhD programs online. That's the educational aspects online, and a lot of students acquire these trainings through online training in the comfort of their homes. So you see that through the use of internet, a lot of students, a lot of persons who have the desire to pursue a career in social work can acquire that training and get certified. And then we also have employment. It also has been able to create job opportunities for social work graduates and persons who have the required skills to get employed through the job seekers and other social work applications, jobs search via the internet. And we have another aspect which has to do with research. We have to do with research. The research here, when we talk about research, a lot of students, a lot of undergraduate, a lot of fellows who are interested in studies relating to humanities are able to carry out and get resources online, are able to gather informations, are able to gather useful data, studies that have been carried out by various scholars through research. And this also helped in equipping social workers with enough resources to develop studies and accomplish given tasks. In telehealth, provision of e-counseling, counseling services online to our patients, which is one of the most useful and common services we provide to clients in need of help. Through counseling, a lot of counseling services can be carried out through the use of telephone conversation. Most times you reach out to your clients, you schedule meetings with them online, and those clients who are compatible with the use of computer and laptops, the phones, benefit from counseling services, e-therapy through the use of internet services and electronic devices. Monitoring and evaluation is also one important aspect of the influence of information technology in a social worker's career. We are able to monitor how well students are coping, how well, to what effect has our casework, what has been the impact of our services to our clients. Where we, through the use of the internet, we're able to check, carry out follow-up services where necessary to each of the clients. Now we'll now look at the NASW, National Association of Social Work Technology Standards in Social Work Practice. These four bodies that came together to to set out standards which social work practitioners must abide to, must keep in touch with, because these standards actually, as a matter of fact, provides guidance for all social workers in the use of technology and in an ethical manner and in service to the clients. These days, we don't just use the information, we don't just use the technology indiscriminately. We must abide by the ethical code of conduct. When we talk about the NAS technology standard, where this implies the ethical standards which every practitioner, which every social work practitioner must adhere to and must comply to in the course of using technology to render services to our clients. The standards by the NAS has been provided here, has been classified into 4 different groups. First and foremost, we have to provide information to the public. 2, to design and deliver services. 3, to gather, manage, and storing information, which is key, and social work education and supervision. So these 4 basic standards, which are being set by the National Association of Social Work and the Association of Social Work Board, Council of Social Work Board as well, basically to help the social worker and social work practitioners to be able to adhere to the ethical codes of social work practice, so as not to go astray, so as not to offer all services with all forms of maintaining ethical standards in the course of our service to our clients. When we talk about the provision of information to the public, the interpretation of this is that every social work practitioner or social worker in the course of carrying out his duty should be able to give out useful information, accurate information to the clients, not to the public. When we were about to disseminate information, send information to our clients through electronic media, electronic gadgets, we should be able, I should ensure that these informations are accurate, which is one of the basic standards that has been spelled out here, and also to design and deliver services. Through, like I earlier mentioned, counseling services is one of the means which we reach out to our clients via the use of electronic gadgets, via the use of electronic media and electronic devices. It's very important here that we should be able to design our service in such a way that we can reach out to the vulnerable persons who live in remote areas, remote geographical locations, who have challenges in meeting what we call mobility, can't move. So with the use of our internet CS services, we are able to reach out to this category of population who really actually needs our services. And our services must be in accordance with the ethical code of conduct in our service provision. It is important for us at this point to note that the standards are in conjunction with the NAS Code of Ethics and social work standards and relevant regulations. Social workers should ensure that the security and confidentiality of the client is protected. That is one of the reasons, one of the most important aspects of the standards being spelled out by the NAS technology standards are spelled out. The security and privacy of our patients' informations are to be upheld and not to be joked with. Importantly, social workers should protect the integrity of the client and abide by the regulations that governs the social work practice. If you are carrying out any form of interaction with your patients or your clients, you are expected by the standards to ensure that you respect your client's integrity, your client's privacy. These standards also explains the fact that all information that we get from our patients, we gather in the course of our interactions online, are to be protected. Those are some of the fears and challenges we find in our practice. The standards are there to guide us to ensure that we do not disclose, or, for example, we have situations whereby systems break down or systems fall out. And when your systems, for example, get bad, some circumstances, you find that the client's information get lost. So the standards prohibit such situations whereby you do not keep information of clients and respect their confidentiality and integrity. So for now, I thank you very much for listening. Thank you for your time.
Thank you, sir, for your informative session. Now the participants can raise the queries by unmuting themselves, or you can post the question in the chat box.
You can't hear me now. Huh? I finished talking.
It's time for them to ask questions.
Hello, sir.
Hello.
Aswati is talking.
Sir.
They can't hear you.
Sir, there is a question in the chat box which was asked by Kishore
Chat
Abraham.
box. Question in
Yes.
chat box.
There's no
How to determine the accuracy of the online therapy?
online therapy. Okay,
Sir?
that's a question.
Okay. I'm going to answer now.
No, Aswati, I think Aswati is talking. I don't know.
Hmm?
I think Aswati is who's talking there now.
This person.
So what she's saying.
This is the question I've been asked. I'm
So-
replying.
No, she's still talking back. Is she
That's
done?
paused.
Okay.
Hello, sir.
Tell her
Yes.
that.
I'm
The
on
question
mute
is,
Okay, no, mute.
hello, sir. Can you hear me?
Yes, I can hear you.
Yes.
Okay.
The
Your
question
question.
is, how to determine the accuracy of the online therapy?
Okay. Yes. If I'm to respond to that, info accuracy online therapy is very crucial and very important therapy sessions. First and foremost, you must be able to have a planned, structured session with your client, and you must have the ability to understand the kind of questions or responses your client is expecting to get from you. Before the online therapy is being carried out, the clients should and the social worker should be able to arrange informations that will benefit the client, that will arrive at, will grant or make a clearer understanding of the treatment he or she intends to provide to the client. Accuracy in therapy it requires a consistent plans. So most times the therapeutic sessions on online are structured from could be 2 sessions, could be 3 sessions, and most times we ensure that it's structured in a way that the client at the end of the day benefits from the treatment. Most online therapies are not just 1 sessions. So most times they are like 2 sessions, 3 sessions with the consent of the client
You knew you were
and the
coming. Why did you
preparedness
say ghostly?
and with the preparedness of the client. I hope I've been able to answer your question on that. Hello?
Okay, sir. Thank you, sir.
Okay.
And the another question that in hello, sir.
I can hear you very well. What can social work practitioners do to handle this assembly?
Let me see participants.
Hello?
Gyara.
Then my open
Gocewa ya ko kuwa
Yes.
Hello,
Yes.
sir.
karewa
social work.
Okay. That's
What are the challenges faced by social workers while using these type of techniques?
okay. If I'm to respond to that, I'll tell you that some of the challenges faced by social workers, the question says, what are the challenges faced by social workers while using online therapy? Sometimes the challenges we observe that some social workers will experience is where a situation whereby the client does not know how to use the internet service. A client who does not know how to come online, who is not familiar with the gadgets, that is one of the major problems. Once we have a situation where we have clients who are not familiar with use of internet, you don't even have any reason to go on have an online therapeutic session with such clients. You have to be sure that your client understands and is able to use the systems, able to use the computer, was able to interact or create time to have such sessions with you. It's very important to be able to have clients that are well familiar before you think of introducing an online therapeutic session. And sometimes we find out that in a part of the ethical issues relating to the use of online therapy, includes the fact the issue, security issues, basically security issues and confidentiality issues. We've observed that over time, sometimes you could have a situation whereby there's a system failure. And when there is a system failure, or for example, other servers or people, clients' informations leaks to the wrong public, or use leaks to the third party, that becomes a very serious problem. And such social work agencies can be penalized for for that. So it is advisable that we maintain some heavy sense of security with our clients' information while we are carrying out online therapy. Thank you very much.
Thank you, sir. The another question is that in Nigeria, generally we have issues of electricity and steady internet connections. What can social work practitioners do to handle this as a major challenge, assuming you need to have a counseling session with a client and this occurs, what can be done?
Yes. Yes, as a matter of fact, this is a very great challenge in Africa, particularly, and Nigeria particularly. You see, when we have issues of electricity challenges, before we have to carry out such counseling sessions with our clients, it's advisable, in fact, it's recommended that the social worker should put in place alternative source of energy, an alternative source of electricity, like the use of a generator plant where you will not have any form of interruption in your power supply. Because basically, most times we normally have inadequate power or electric supply. So what we expect to do is to see that we keep sure that we keep before we start the online therapy, we ensure that the environment we are going to use should be able to have light supply. Policies have been made, some efforts have been made by social practitioners in Nigeria to reach out to government agencies to see how to improve the problem of electricity supply. But honestly, in Nigeria, we still expect that some level of improvement when it comes to electricity supply. Yes, it's a great challenge, but I believe that with time, things will improve. But most importantly, we just have to ensure that before you embark on an online therapy or counseling session with your client, you should put in place every modalities, especially when it comes to electricity and power supply. Thank you. Thank you.
Thank
Hello.
you, sir.
Yes.
Hello.
Hi.
I have a question.
Okay.
Hello. Hello.
Hello. Hello.
Hello.
I can hear you.
Yeah, I have a question, please. Yeah, my question is just like a rider to the earlier question. In developing countries, like you rightly said, particularly Nigeria, where the energy is not promising.
Okay.
That's one aspect. Another aspect, in counseling a patient, there are things for consideration apart from verbal communication. There are what is called or what is known as non-verbal communication, whereby you can deduce some information while counseling your client face-to-face interaction.
Mm-hmm.
So if you adopt the ICT method of therapy, how will you be able to assess some non-verbal communication from your client? That is one. Secondly, there are situations whereby some clients, they don't even have the means of they don't even have the means of acquiring the ICT gadget, not talk of recharging them to be able to communicate to their caseworker or to a social worker. So do you think what category of clients this ICT techniques or method, what
Okay.
category of clients or patients that is more important to apply ICT as a form of therapy or a process of giving therapy to clients? What form of patient, what type of patient?
Okay.
Thank you
Yes.
very much.
Okay. Thank you for your question, sir. Like you said, what form of clients, what type of category of clients should we introduce e-therapy, counseling therapy, online sessions with? There are certain there are some clients who can afford online interactions. There are some clients who are able to, purchase this client equipment, gadgets, and even, like you said, buy data and then come online to meet with their social worker. Those category of clients, with their consent, you can create, schedule an online meeting with them, counseling sessions with them. But for the clients who are vulnerable, who are poor, from very poor backgrounds, you may not necessarily need to carry out the information e-therapy or online counseling sessions with those category of clients who come from very poor backgrounds. Certainly, we know that those category of clients will not be able to afford that. So I most times observe that counseling sessions online with clients, most are for clients who are able to, purchase, who have a system at home, who have a laptop at home, who have a means of, maintaining or going online to meet with their social worker. Those are the category of clients that would benefit from session.
What I'm trying to find out. I'm not talking about their poor background or they are rich or they are poor. What I'm trying to find out is, different clients have different medical diagnoses, have different social diagnoses. So of what type of diagnosis, either medical or social, that you will involve them or you'll engage them in ICT or e-counseling or e-therapy? Of what type of diagnosis? Patients suffering from cancer, patients suffering from diabetes, patients suffering from HIV and AIDS, patients suffering from chronic liver disease, patient accident victim, patients suffering from schizophrenia, like in psychiatric setting, patient manic depression, or what sort of patient category of patient in term of, I'm talking in term of diagnosis, not in term of financial background. Thank you.
Okay, I look at the possibility of you carrying out online sessions with patients who have mobility movements, who have some form of disabilities with movements, they are physically challenged who cannot move. For example, the handicap, physically handicapped, their legs have been amputated. Those category of patients have a challenge in moving from one destination to another. So for them to reach out to their social worker, they will prefer to go online. So the diagnosis for some of the diagnoses you see are patients who have mobility issues. Even those who have diabetes and other forms of illness can also benefit from the use of online sessions, online therapy. The diagnosis doesn't really has to be an issue there, but you know that, like I said, mobility patients with challenges in movement are the ones who really will benefit more from online therapy, or patients who live in geographically remote areas but can afford the sessions, will benefit more from information technology. Thank you, sir.
If you are talking about patients that are living in a remotely area, maybe villages,
can afford, yes,
hamlets.
Yes.
Some hamlets, in Nigeria, some hamlets, some villages, especially your remote villages, don't even have the network to link up with the distance, to not talk of even having the money to buy the data. They don't even have the network, because there are many villages that you go, they don't even have the technology there. So even if they have the means to buy the data, but they don't have the provision of the technology. So I really do you think this is ripe for developing countries? This sort of kind e-therapy, is it? Do you think is okay? Is possible in developing countries?
Okay. Yes.
Because there are a lot of patients that they don't even know. They don't even know how to operate the phone. Some, especially from the villages.
Yes.
Yeah.
You're right, sir. These are some of the challenges. These are basically just like what you rightly said. These are basically the challenges we face in Nigeria and our local rural areas. Like you rightly said, challenges of electricity, network, which is much important, and affordability. So Well, Nigeria is still a developing country, and we will keep experimenting with this new technology as our society is evolving. As our society keeps evolving, I know we'll get to a level in Nigeria where even the rural area persons will be able to have access to good network. I know with time, with good leadership and good government, I know there will come a time where persons who reside in those remote areas will be able to have access to good network. That's always that's our prayers and that's our desires, and those are the kind of things we hope that our country will get to that level. But for now, since we are still a growing nation, I believe that it may not be very effective when we think in terms of application. But I believe as time goes on and society is evolving, things will certainly change for the better, and for the better for especially for those who stay in rural areas and issue of poor network. Thank you.
Well, this is discussion that we can go on and on. Thank you very much. Thank you.
Thank you, sir. Thank you, sir.
Mm.
Thank you, sir.
Thank you, sir.
Thank you.
There is another question
Okay.
from Siddharth. What are the ethical issues of online therapy?
Come again. Can I get the questions again?
What are the ethical issues of online therapy?
The ethical issues of online therapy. Did I get you?
Yes, sir.
Okay. The ethical issues are basically um, observing. When we look at the ethical issue, we should also put in consideration what does the National Association of Social Work technology standard spells out. We should also look at, is it in compliance with our the ethical codes of social work practice, and basically looking at another issue of dilemma, looking at another issue of inability to maintain security of clients' information, system failure, network system, or whereby our data machines or our gigantic storage devices crash down. And then you see the client's informations are not saved or get missing or lost. Those things could also lead to affect our practice as social workers. Those are some of the cons, the cons about the use of information technology in social work practice. So according to the National Association of Social Work technology standard, we should ensure that we try as much as possible to be able to avoid any form of happenings when it comes to clients' informations, vital and sensitive informations and data. We should be able to store them effectively, whereby they don't get to the wrong users. It doesn't get out of control. It should be able to be maintained within the emphasis of the caregivers. Thank you very much.
Thank you, sir. And one more question. Please, can you explain how the e-therapy works?
Hello? Can you come again?
How the e-therapy works?
Yes. E-therapy, like we all know, it's electronic therapy. It depends on the structure of sessions you have arranged to provide for your clients, you have arranged to give to your clients or to the patients concerned. It's basically the use of electronic gadgets, electronic appliances with structured sessions for the clients. The therapy sessions are a form of interactive sessions where you meet with a social worker meets with a client and then provide some form of counseling interventions. After effective listening, after building that rapport with the patient or with the client, the social worker is able to, educate or psycho-educate the client while the interaction is going on. So most times we use forms of software applications in our e-therapy, like I earlier mentioned, the information data, medical records, the data management. Those are software applications are very useful while we're carrying out e-therapy. Thank you.
Thank you, sir. I hope there is no further questions. Thank you, sir, for clarifying all the doubts raised by the participants.
Okay.
We are moving to the end of this webinar. Let me invite trainee social worker Tom Anthony for delivering vote of thanks. Tom Anthony? Hello, Tom?
Maybe some connectivity issues. Actually,
Sir,
maybe
we can
connect
wait.
with another person.
Okay, sir. Okay, let me invite Anju Shaji, trainee social worker of Sri Sabrisha College, for delivering vote of thanks.
Hello.
When sir, that was a good
Yeah,
session and
Tom
was
Anthony is here, sir.
valuable for, yeah, very valuable
Sorry for the
session.
inconvenience. Hello.
Yeah, now audible.
Okay, sorry for the inconvenience. Good evening, all. It gives me immense pleasure to deliver a vote of thanks for this occasion. First of all, let me express our sincere gratitude for leading such an informative session. Next, I extend our principal, Professor V.G. Harish Kumar. Thank you, sir. Next, I would like to thank my dear teachers for making them a successful one. Finally, I thank all my dear participants and colleagues for being such a wonderful audience and utilizing this program to its most. Thank you.
Thank you, Tom. Once again, thank you, sir, and thank you all for joining with us.
Thank you, Ikman sir. Thank you for the wonderful session.
Thank you, sir.
Thank you very much. It's been a wonderful session. Thank you.